Yeah, one of my son-in-laws is also riding in that for the first time. Yeah. This is the first time he's done it, but are you and Tom?
I'm sorry. No, I'm not.
You're not.
I believe Tom is again.
Well, I wondered about that because, he had that shoulder, wasn't it a shoulder operation that he had? And I didn't know whether he had time to train.
We do have about 3 guys in our station that are.
But that's not one of those things you want to go up and ride in just because.
Not for grants.
No, they usually have they'll usually lose somebody.
Oh yeah, drops off.
Yeah, well, mine just drops off. I mean, dies. They really drop off.
No thanks.
My father-in-law used to help with all that. He was one of the ones that helped man the stations.
Ah. Is he a physician?
No, he was just a volunteer.
Oh, okay.
He actually also was in charge, after the tornado, he was in charge of the cleanup and rehabilitation for the city. Give him a great spread here.
Yeah.
Okay, put your switch.
You've been moving a lot. Have you been moving a lot?
Just a little bit. Just a little bit.
Encroachment.
I know.
You got your stack of stuff.
Your Honor, we're making a copy of the agenda, of the written agenda for you this morning because we have a large number of issues that deal with the agenda so that you'll have that for your reference.
Okay.
Here it comes.
When will I receive mine?
Morning, JD.
Good morning. I asked GK, when will I receive mine?
Probably tomorrow morning sometime. Is that okay?
Okay, well, I'll see y'all then. Changes to the agenda. Don't call me back.
Clerk will call the roll.
Glenn Whitley, County Judge.
Here.
Roy Charles Brooks, Commissioner Precinct 1.
Present.
Devin Allen, Commissioner Precinct 2.
Here.
Gary Fickus, Commissioner Precinct 3.
Here.
J.D. Johnson, Commissioner Precinct 4.
Here.
Constitutes a quorum.
Thank you. Our invocation today will be delivered by the Associate Campus Pastor Kate Gregory from Life Church in Keller. Thank you very much for coming out today. After the invocation, please remain standing for our pledges.
Father, we thank you that you are good, that you're faithful and you're true, and we just thank you for the opportunity that we have to live in Tarrant County and for the people who serve all of the residents of Tarrant County. I pray that you would give wisdom and discernment to every commissioner and to the judge today as they go through this meeting. And God, I just thank you for the fact that they serve us so well. And so God, thank you for the honor it is and the responsibility that it is that they hold. And thank you for putting it in capable hands. In Jesus' name, amen.
Amen.
Yeah.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Honor the Texas flag. I pledge allegiance to thee, Texas, one state, under God, one and indivisible.
Morning, Your Honor, members of the court.
Good morning. Morning.
Morning.
We have some announcements as it relates to the agenda this morning. We'll start by going to the administrator section. Item A5, which is the agreement between Tarrant County and Acclaimed Physician Group as it relates to juvenile medical services. We've now received a marked up copy of that agreement back from Acclaim and JPS. And we're going to hold that for this meeting because I want to confer with the district attorney's office and also Mr. Medlin out at Juvenile to make sure that we're all in agreement. We will bring that contract back to you on the 30th for execution. On item number 8, A8, this is the sheriff and constable fee schedule, which is required by law that we do this. We do have an audience participation form as it relates to that particular item, and we're removing that from consent, but we will take that for action when we get there. Under the administrator section, item A17, this is the 22-23 State Health Services HIV contract with AIDS Outreach Center. There's a revised court communication in that there was an error on the funding amount, and we corrected that error, and we're asking your approval. We do not need to remove that from consent.
All right.
Under 10H3, this is under facilities management. This is the sale of art in the sub-courthouse in Arlington. We did a minor correction on the court communication, and we'll be asking for your approval on the consent agenda for that one also. So we can move to purchasing. Item 10K1. This is the sale, is 2022-020, I'm sorry, 2022-202, sale of recycled paper. As we historically have done, you have a new court communication in there indicating who the purchaser of that surplus paper is. Also, under purchasing, item 10K6, this is RFQ 2022-188. We're going to ask that we hold that, and we'll bring that back to you next time. Also under purchasing, item K10. This is RFP 2020-142. We'll need to hold that also. There was an error in that document. We need to correct that. Also, as it relates to the agenda, we're going to take certain things out of order. As we get to the administrator section, we're going to ask Mr. Tenasia to come up and do a quick presentation as it relates to public health related issues. Also on item number 2 in the administrator section, there is a slide presentation, and that deals with Arpa and funding for housing, supportive housing. And then also when we get to the budget piece today, we are going to have some discussions on budget. And what we would like to do on budget is, we've provided you a copy of the report concerning juvenile detention. We also have the hospital district here. You raised an issue in our budget meeting about the closure of clinics at schools. And so we'll have a presentation on that to close the loop on that aspect. And then we're also going to talk with you about salaries for certain elected officials. We'd like to nail that aspect down today, simply because the next meeting that we have, because we're not going to have court this next Tuesday, is going to be on the 30th, and we need to publish those by September 2nd. So we're not delayed in our publications. So we'd like to get direction from you on that, and Helen will be leading us in that discussion, and I'll be assisting if she needs any help. Finally, there's not going to be any court next week. So our next court meeting is going to be 2 weeks from today, which is August 30th. And then the IT Steering Committee is meeting today at 2 p.m. in the Family Law Center.
Question.
Yes, sir.
At what point in the agenda are we going to consider the hospital district's presentation?
It's going to be during the budget process. It's part of the briefing, and it'll be when we get to that particular point.
I hate for them to have to sit here all day long, Dr. Duncan and Board Chair Dorothy DeBose.
If we would like to bring that up, I would suggest that we can have that discussion, but if you will allow us to go through at least item number 2 in our section, simply because we have all the slide presentations and different decks in order, if we could do that, if that's the will of the court, we can move them up for their presentation.
I'm fine with that.
Yeah, let's do that. I agree with you. There's no reason for them to.
Okay, that's what we'll do. Thank you all.
Thank you.
Court members, any announcements that you wish to make today?
Yes, thank you, Judge. I do have one brief announcement. Last week, I had announced that we would be hosting our quarterly Precinct 2 JPS Community Update meeting later this month, but we've had to reschedule that. So just stay tuned for the new date. Will be in early September. Thank you. That's all I have.
We had a very successful Alzheimer's event, Healthy Lives Matter Alzheimer's event this past Saturday. Had about 200 people in attendance and exhibitors from all over the county. It went extremely well, and I think people were served.
Congratulations.
Out-of-state travel. Okay, the one thing that I had an opportunity to do last week that I was very proud to be able to do was to attend the bill signing for the PACT law. That was a bipartisan bill that was passed that dealt with veterans who had experienced the burn pits. And it was a privilege to go up to Washington and be present at that bill signing. A lot of people there. It was a privilege to be up there for the bill signing. It took me a while to get back. Basically 2 days, but it was great, and I enjoyed that very much. And again, it was a very bipartisan type of a bill.
You're right, it was a bipartisan bill, and I'm glad you went up there to represent Tarrant County and our veterans in Tarrant County.
Yep, they certainly. Yes, they've done a great job. The veterans continue to be the people that we need to be most thankful for. Any other comments at this time? Then with that, we'll move to the approval of the minutes of our special call meeting of August the 8th and our regular meeting of August the 9th.
Move approval of both sets of minutes, please.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson? Commissioner
Yes.
Dickus, you need to hit your button. Motion passes unanimously. Commissioner Brooks, I believe you have a proclamation.
I do indeed. This proclamation recognizes Prostate Cancer Awareness Month. Those of you who have been around here for any length of time with me know that prostate cancer and its early detection are among my passions. I am a prostate cancer survivor, and I credit my survival to early detection. And I want to make sure that all men have the opportunity to survive just the way I did. And last week, we concluded here in Tarrant County prostate cancer screenings for all Tarrant County employees. That was a very welcome development, new development in our health offerings. So I want to read this proclamation into the record. And it reads, whereas prostate cancer constitutes 20% of all male cancer diagnoses and 10% of all male cancer deaths. And whereas in Texas, an estimated 17,850 new cases of prostate cancer and an estimated 2,260 deaths will occur in 2022. And whereas men of African ancestry, men with a family history of prostate cancer, firefighters, and men exposed to Agent Orange are at highest risk. And whereas prostate cancer is the second most commonly diagnosed cancer in American men, only behind skin cancer, and the second leading cause of death in men behind lung cancer. And whereas this year, approximately 268,490 men will be diagnosed with prostate cancer in the United States. That's one man every 1.9 minutes. And roughly 34,500 will die this year from the disease, which is one man every 15.2 minutes. And whereas 1 in 8 men are diagnosed with prostate cancer in their lifetimes, men of African ancestry are at the highest risk for the disease with a rate of 1 in 6 men, and they are also 2.1 times more likely to die from the disease. And whereas prostate cancer not only affects men, but also affects their families and friends, and whereas all men are at risk of prostate cancer, therefore education regarding prostate cancer and early detection strategies are critical to saving lives and preserving and protecting our families. Now, therefore, be it resolved that we, the Commissioners Court of Tarrant County, do hereby proclaim August 2022 as Prostate Cancer Awareness Month in Tarrant County, and encourage the citizens of Tarrant County to increase their personal awareness of prostate cancer and the importance of prostate cancer screenings. In witness whereof, we have hereunto set our hands and caused the seal of Tarrant County to be affixed this 16th day of August, 2022. And Your Honor, I move approval of this proclamation.
Second.
Second.
We have a motion and a second. Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Your Honor, we have here this morning to receive this proclamation, Mr. Wolf from Blattner with the North Texas Prostate Cancer Coalition. Wolf is a longtime partner with My Healthy Lives Matter prostate cancer initiative and is a soldier in the fight for early detection and screening of men with prostate cancer. So I welcome Wolfram to Tarrant County Commissioners Court this morning.
I am Wolfram Plattner. I'm a former president of the North Texas Prostate Cancer Coalition, and I'm a 17-year survivor of prostate cancer. Commissioner Brooks read the proclamation. What the proclamation doesn't tell you is that over the last 3 years, the number of new cases has increased tremendously. Why that is for somebody else to figure out, hopefully pretty soon. Of course, this indicates the importance of awareness of cancer that can affect every man. It affected apparently one person on the court, and it affected myself. We are hoping that the county can make this information available to the public. In 2021, the coalition addressed 15 out of 26 counties in the central North Texas area. And of course, we are trying to increase this number this month and next month. I also will post the proclamation on the Tarrant County community page in Facebook. And I hope that the commission can increase the number of places where this proclamation is attributed. To top of this, we asked the governor to sign the proclamation. And 2 weeks ago, he did. And here it is.
Wonderful.
The occurrence of this cancer can be detected and monitored by a simple blood test, as I assume everybody knows. Wheels for Wellness will have the yearly car show September 17 on a Saturday in downtown Fort Worth, and it includes a 2 or 3 hour screening for prostate cancer. And with screening, we are just talking about the blood test, so nobody has to worry about it. Awareness and early detection, of course, are still the key for defeating this disease. There are several treatments available once the cancer is found. After 17 years, my cancer is still active, and you wouldn't have guessed that unless said I told you just now. No visible marks. I look like any other guy. I still enjoy life, and I thank early detection and a great medical team for that. Prostate cancer numbers are similar to breast cancer. It's just that men don't want to talk about it because some of the issues are a little sensitive. October is Prostate Cancer Awareness Month, so let's make September Prostate Cancer Awareness Month. If the governor can sign this proclamation, so can every of the 26 counties that we have been addressing. Thank you, Judge Whitley. Thank you, Charles Brooks. Thank you, the Commissioner's Court, for letting me address you with this issue. Thank you very much.
Thank you, sir.
Thank you, Wolf. Let me just say that my Healthy Lives Matter prostate cancer education and screening event will be in person again this year for the first time in 2 years. It will be held in February, Valentine's weekend, Saturday. It's intentional that we have it Valentine's weekend because we appeal to the women who love men to bring their men out to be educated and screened, and it's an entirely free event. More to come about that later. Also, I know, just because I know, that there are other men in the room who are prostate cancer survivors. I say to these, my brothers, congratulations. I'm glad we're all still here.
You forgot to mention that over the last several years, you have managed to have a online testing, and which I thought was great, and it was very significant, and it was very successful. Congratulations.
Thank you, Wolf.
Thank you. Court members, you have before you the consent agenda with the items revised and noted as previously by Mr. Manius.
And, Your Honor, just to make sure, I believe I did mention this, but the two items under the Sheriff's Department are also, which are consent items, we're taking those off of consent, but we'll take action on them when we get there.
Move approval of the consent agenda, save and accept those items that have been removed.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. I believe we have a public hearing today.
Morning, Your Honor.
Good morning.
Commissioner.
Morning,
Morning,
James.
James.
We're asking the Commission to consider, have this public hearing to consider amendment number 7. Those changes are before you. After we receive public comment and you close the hearing, that'll give us authority to go ahead and execute these changes. And as normal, we will bring those contracts back before you.
At this time, I'll open the public hearing and ask if there's anyone here wishing to speak to this matter. Appearing to be none, then I will close the public hearing. Ask for action.
No action necessary.
No action necessary. Okay, thank you very much.
All right, thank you.
Thank you.
Thank you, James.
Okay, Mr. Manius, we are at your section. I think you said you wanted to do number 1 and 2 before we brought the hospital district down?
Yes, and prior to that, we're going to ask that we go to the briefing items and ask Mr. Tenasia to come forward and make his presentation concerning health-related issues.
Good morning, Your Honor, members of the court.
Good morning.
Morning.
I'm back and want to start again with some update on our back-to-school vaccination events. It's great news I wanted to share. We've seen already, it's only been 2 weeks, halfway through the month, 5,900 clients have been seen and almost 14,600 different vaccine doses given. So first of all, I want to thank my team because they're really working hard, but I also want to thank those parents that are bringing their kids to have a safe back to school. Last couple of years have been disruptive to everybody's lives with schools having issues with COVID and other outbreaks, and at least a lot of these vaccines prevent outbreaks. So we certainly want to encourage parents and keep the momentum going for the next 2 weeks. This is very, very important for our community to catch up on these childhood vaccines and get kids, back to their caught-up status on vaccination. So that was the good news. Just wanted to share that with you. Very, very proud of my team.
I want to thank you and your team for your immunization efforts for back to school. I am keenly aware of the importance of these immunizations. I am also aware that some childhood diseases that these immunizations have been designed to prevent are on the upsurge.
Yes, sir.
Because there are reluctances on behalf of some parents to get their children immunized. I would say, just as a general statement, that to the extent that children are not immunized, then the entire public is at risk.
That is absolutely correct. Thank you for bringing that out. Yes, sir. All right, so on with some partial good news. I mean, there's bad news in there that we're still at a COVID high level in the community, but if you start looking at the data carefully, all the trend lines are starting to dip lower. So looks like we've had a decided peak a couple of weeks ago, and we're starting to head lower. And that is corroborated not just locally, but also nationally. Case counts are starting to come down. We hit a peak for a few weeks that was about 130,000 cases reported nationally. We're down to about 100,000, so it's a decided downturn. In all of this, we do understand that, you know, the reporting of data is kind of incomplete because a lot of folks are still testing at home, which is good. I mean, it's convenient for everybody, and that's great. They know their status, but those are not reported, so it's a sort of an underreported number, but that's okay. There's enough data to give us trend indicators to see where we're going. And, you know, our concern remains that we're at a high level, schools and colleges are opening. That can change things or put an upward pressure, delay the downward decline. So the message hasn't changed, that if you're going back to school or going back to college, make sure you're up to date and caught up on your COVID vaccines as well. That way you can have that back to school, back to college very safely without a lot of disruption. There's also good news on guidance that came out from CDC. This week they looked at all the picture that's developing and eased a lot of COVID-related guidelines. We're in a different place as a nation. And in their latest guidelines, they've taken away the need to quarantine after an exposure. Now, if you develop symptoms and you're sick, you still have to go home and do your 5 days and, you know, come back after, you know, testing and wearing a mask, all those type of things. But the folks that are just like in a workplace or in a school setting, college setting, there's a case in your classroom, well, you don't have to quarantine anymore. All of that has disappeared. All they're asking is strict 10-day mask adherence, which I know can be challenging in a lot of settings, but that's what the guidance is, that, you know, as a trade-off from not quarantining, let's wear that mask for 10 days if you have an exposure. That way, if you do develop symptoms, a lot of people start spreading the virus 2 days ahead of time. That way you're not exposing other people and you're limiting that risk. So that's that. And then one other piece of good news developing, we've been, you know, waiting for this bivalent vaccine for COVID that covers not only the original strains but the Omicron strains. Looks like it's moving. UK just approved it yesterday for their use. Hopefully our FDA will review the data, and, you know, in the next couple months we're hopeful that we'll have access to that here as well. We'll keep an eye out on their meeting dates and all those type of things, but an approval in UK gives us a good indication that, you know, we're heading in the right direction on that. So that's the update on COVID. And real quick, on the not so good news part, monkeypox outbreak, unfortunately, it's been growing. I think last week you all saw that U.S. declared it as a public health emergency. We had at that time about 7,500 cases. Now we're up to 12,000 cases in the U.S. And the chart below shows you how quickly it's escalating across our country. Worldwide, there are 32,000 cases in 88 or 89 countries, I believe. And then in Texas, we're at almost 1,000. I think we're 992 or something of that sort. So it's growing, but also very different than where we were with COVID, right? When COVID came, there was no vaccine, no treatment, really no tools to fight COVID other than some public health measures of social distancing, wearing a mask. Very different situation with monkeypox. We have vaccine available, and we have treatments that were designed for other illnesses, but they work with monkeypox as well. So even though these things are in limited supply, we still do have the tools to fight it. And vaccination efforts are gaining momentum. I think I mentioned to you all, over the last couple of weeks, we had received about 1,100 doses in the first round of vaccines. We gave away about 700 to our community partners, most of which is used. And then we held back a few hundred doses. I think out of that, we've used about 340, 350 doses, have a little stock on hand from that lot. And then last week, the feds decided that there's limited dosing available, and it's a vaccine that's given under the skin, subcutaneous. But they did some studies, found that if you change the route of administration to intradermal, just like a PPD skin test, put it in the skin, you can actually use 1/5 of the dose and get the same results. So as a result of that, now we have 5 times more vaccine available. And so this week we received 1,500 vials that showed up on Friday. That's 7,500 doses on hand. Yes, sir?
Is that, refresh my memory, is that the way the original smallpox vaccination was handled?
I believe it was subcutaneous as well, but it did leave a little pox-like, raised bump there. I don't think it was intradermal. I'd have to go look. It's been a while. Yes, sir. It's been a while.
It was not a shot.
Yeah, it was a little
taking
bit.
it and poking it into the skin.
Oh, well, I'd have to go look. I mean, I was a baby when I got mine.
All right. You were not in this country at that time.
Sensitive.
Yeah, be careful with this
All
age
right.
stuff.
So we have 7,500 doses, and we have survey results back from our partners, so we'll be working with them again to distribute out vaccine. And then we are also relaunching our clinic because we had to take a little pause, vaccine was out. And also there was a change in strategy that requires rewriting of the delegation order from the physicians and retraining of the staff. So starting again tomorrow, this Wednesday, we're gonna reopen our clinic. Again, limited outreach to the target population at high risk. Still, we don't think that there is a risk to the general public at large, but we have an online scheduling tool available. People can book an appointment. That way it's very organized. And we're gonna, keep working on that and get the vaccine out as quickly as we can. But again, I wanna, thank our community partners who are helping us, organizations like HELP, you saw them here last week. There's AIDS Health Foundation, there's JPS, they've been a good partner in this, and a few others. In fact, I had a call with another clinic this morning who's very interested. So as the word gets out that we have vaccine, a lot more partners are willing to work with us. So we want to thank them all, and that's where we are with the monkeypox situation. More than happy to answer questions on COVID or monkeypox.
Any questions? Oh,
No
go ahead.
question. I did just want to express my thanks for you making time, along with others, for the monkeypox virtual town hall that we hosted last Wednesday. That is still up for viewing on my official Facebook page at COMM Devin Allen. So if you all answered a ton of questions, and there were a lot of really good questions, folks wanting to educate themselves on monkeypox. So I'm just going to encourage, if you need some more information, to please go to the CDC or our public health department, or even go to that town hall, versus perhaps receiving information from less reliable, factual sources.
Thank you.
Yeah.
Okay, members of the court, we can now go to the administrator section. Ms. Camarena was going to do items 1 and 2.
Good morning, Judge and Commissioners.
Good morning, Kristen.
Under the Administrator's section, Item 1, we ask that the court receive and file our weekly COVID-19 recovery report.
Move to receive and file.
Second. We have a motion to second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Under item 2, there are 3 separate actions. A, we're asking the court to approve, I apologize. There is no action required on item A today. No changes to the fiscal funds budget. Item B, we ask the court to receive and file a list of agenda items that appear on today's agenda and have been previously approved or recommended for funding with the FRF budget. And that is attachment A in your folder.
Move to receive and file.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you. Under item C, we're going to ask the court to consider and take action on recommendations for use of our Arpa housing dollars. On May 1st, with the approval of the FRF budget, the court approved $32.5 million for items related to housing. What Lauren King, the Executive Director of the Tarrant County Homeless Coalition, will present to you today is a set of recommendations for use of that $32.5 million. And these recommendations come after months of discussions with community stakeholders around the areas of housing and homelessness. With that, I'll ask Lauren to come up and present. And after her presentation, there'll be some time for discussion and then a couple of next steps and action.
Good morning.
Morning,
Good
Lauren.
morning, Judge and Commissioners. It is great to be here. I'm very excited to be here. I'm not even going to pretend I'm not. How do I, just start doing?
Just push a
There we
button
go.
and see
Okay,
what
there we go.
happens.
All right. As Kristen mentioned, today we're discussing the use of $32.5 million that was allocated by court for housing. We have been meeting, I'll go ahead and go to this, an COC ARPA work group has been meeting for the past couple of months to discuss how to use these funds and what type of capital investment to make with these funds. Those are the committee members comprised of quite a few Tarrant County staff, elected official, Arlington, Fort Worth, and then a representative from MHMR, who is also, a number of these people are from the COC board as well. So we made sure we got a variety of people and also made sure that no one who was actually going to get the funding was on the committee. So as an overview, all funds will be used for capital investment to either acquire or build housing. So it could be new construction or it could also acquire and rehab if needed or just acquire and use. Also could be used to acquire land for future development. All funds that have been allocated are going to be dedicated to people who have experienced homelessness. There are 3 different types of development that we're wanting to do, all of them paired with services as well. So one is permanent supportive housing, the second one is supportive housing, and the third one is deeply affordable. And I'll talk to you a little bit about who that benefits. So permanent supportive housing is for people who are chronically homeless. So those are individuals who've been homeless for over a year and who have a disability. So often when we think about chronic homelessness, if you think about kind of stereotype maybe of what people think about, this is the group. It makes up about 20% of our population, but they do, I would say, cost publicly the most money. So they're using our jails, our hospitals the most. It is very, very cost effective to house them and to give them the services needed. So permanent supportive housing, as I mentioned, people have been homeless for more than a year and have a disability. Supportive housing is similar, however, yes.
This disability does not have to be a physical disability.
Correct. It does not.
It can be a behavioral health disability.
Correct. It can, yes.
And all 3 of these are HUD definitions.
They are, yes. We will have, and we've talked a little bit about, what will this look like? How will you structure contracts? Because obviously with an investment in capital, the investment is going to last a long time. So I think there will be some provision in there of if we get to the point where there is, we don't have someone who fits this description on the street or in the shelter, then we would expand to other individuals and families in need. So. Supportive housing, similar with a disability, physical or behavioral health, but they've been homeless for less than a year. So we have a large number of our population who their needs are not severe. However, we know that they need ongoing rental assistance and case management. And so supportive housing will help provide that. And then deeply affordable housing is for primarily families. So when families experience homelessness, it's generally economic. They cannot make the numbers work for them. They cannot afford childcare and rent and food and all the other things that go along with living. And so for our families and individuals who are working, they need deeply affordable housing where they can be earning a wage and also can afford market rent. Or not market rent, they can afford the rent that we're asking them to pay. They cannot afford market rent. So they meet the guidelines, the ARPA guidelines specified in the Act, but then it also meets a pretty significant need here as well. So to give you an idea about the county-wide investment strategy as far as how we define the need, so we estimated, I won't go through all the details on this chart, but that we needed 222 units total of permanent supportive housing developed with capital funds. We needed 250 of supportive housing, and we need 250 of deeply affordable. Can be a variety of types of homelessness. Again, we've gone over the populations it serves, and this investment, this need is actually divided amongst Fort Worth, Arlington, and Tarrant County, and there is also some private interest and private investment, so we've been talking with them as well to leverage as many dollars as possible. We also have the opportunity to potentially pull down money from the state, so we're really looking at everything we can to meet the need here. So as far as what we recommend on the 32.5, for permanent supportive housing, we're asking that you all approve $4.25 million. That will develop 34 units of permanent supportive housing. Again, it'll house the chronically homeless and can be a variety of types of housing, small multifamily, duplexes, quads, motel conversions. So we have a number of different types of these developments across the city and the county. And we found them to be successful. For supportive housing, we're asking for $21,785,000. This will develop 175 units, again, for people experiencing homelessness with a disability. And then for deeply affordable, we're asking for $6,465,000 to develop 45 units. Any questions on those before I?
And this money would be spent throughout the county?
Correct.
Some Fort Worth, some Arlington, but other, not, you're going to do a call for projects.
Correct.
So the call for projects could be from anywhere in the county.
It could, yes. So we, great transition for me. We are working through some preferences and priorities. So we are looking at, one thing we heard from the committee and from commissioners was having that geographic distribution. So having an emphasis and giving cities outside of Fort Worth and Arlington the opportunity to access this capital. And so to put projects there, developments there if they would like to do that. We also do want to move quickly. Housing is very needed, as I'm sure everyone knows. And so if we can move quickly, we would like to do that. We will have some priority populations. We want to make it so that we know we have some populations in need. One specifically we've talked about is criminal justice involved. Again, people with a disability, older adults. And so we're wanting to make sure that these developments target some of those populations that we know have a high need. We'll also be looking at leverage. So we want projects to come to us with a relatively diverse capital stack. It could be other public money from other jurisdictions if they have that opportunity. But again, as I mentioned, I've been working with some private foundations, other private sources to potentially put money into this project, looking at how to, land acquisition, that sort of thing. So other resources that are brought to the project, those will be weighed as well.
This would demonstrate our desire for jurisdictions that receive these housing dollars and have also received Arpa funding of their own to have some skin in the game when we build this housing.
And I can give you a brief update on that.
Just a preference, not a requirement.
So Fort Worth has allocated $20.25 million to permanent supportive housing. Thus far, they have actually awarded 12 of that. They have an RFP out for another 8 right now. They are also considering another 8 for the deeply affordable category. So they, in the end, hopefully will put in about 28 million to housing development overall. So, and then, like I said, working with a few private, Commissioner Allen, I don't know if you want, Arlington has not decided what their commitment will be or what they are going to do on housing at this point.
Yes, you're reading my mind. I was going to ask if we had heard the latest about Arlington's commitment.
We have not.
Okay.
I do not. Kristen, did you get any update? Okay. We have not heard at this point.
Okay,
So.
we'll be following up on that.
Okay. We also will expect entities who apply for this funding to come with operational funding secured. From the beginning, when we started having these discussions, did not ever want this to be where we said, we need this capital investment, and oh wait, 2 years later, I actually need operations as well. We are working hard to pair together resources that we already have and new resources that are coming into our community from HUD to support rental assistance and case management. Those two things are generally tied. We do some matchmaking between nonprofits and developers, so we work on the back end of that. But we do expect them to have an idea of operational funding and a realistic sustainability plan when they come with their projects. And then, of course, projects including collaborative partners. So looking at how we can utilize healthcare providers. So JPS and MHMR, they're very, very involved with our system already. And so how do we leverage what they're already doing and really enhance our programs? And then oversight and sustainability. Tarrant County Community Development and, of course, the administrator staff will work together with the Homeless Coalition to work on an RFP, to release an RFP for a call for projects. Community development will actually provide ongoing oversight for the life of the project, so just ensuring all those federal guidelines are met and adhered to. And then applicants, like I mentioned, are responsible for associated rental assistance and ongoing operations. And as the Homeless Coalition, we are helping with that to help pair together. There are so many resources coming into our community. We want to make sure that we're maximizing and leveraging everything we possibly can. So any questions on this?
Well, I have a clarifying comment, and this mention about Arlington and if they've made a commitment. I just want to make it clear that I hope that Arlington will make a commitment, with it being the second largest city in our county and having received their own ARPA dollars. And I know that this has taken quite a bit of work to get to this point, and I'd like to see for all of our major partners to do their part. I'll also add, for the oversight and sustainability, I know this is something that we discussed, but I just want to reiterate how important it is to make sure that we're putting together the review committee, that we have folks on there that have lived experience and that really know and understand what it means to struggle to pay your rent today. Mm-hmm. So I think that'll be really important. And certainly for all the work that's been done so far, Judge and everyone who's on the committee, this was a heavy lift, so thank you all for getting us to this point.
I feel very good, too, about the way this has been approached, and I think the possibilities of that. And as Commissioner Brooks and you indicated, we're really looking, and we've said this all along with our ARPA funds, we are trying to leverage those dollars. I still believe that if you looked at all of the dollars that have come to the various entities, whether it be in the form of grants from, for childcare, or whether it be the ARPA funds, or whether it be school dollars that have come from the state, that this county has probably received in excess of $2 billion. And I think we're going about the spending of that very deliberately and making sure that we're, doing things which we're doing it collaboratively and not independently. And I think that's going to, in the end, be much more beneficial to our citizens and everybody concerned, and will be a much better use of those dollars. So I appreciate you coming out.
I've got a question. Have you been able to meet with any of the precinct 3 cities?
Any of the precinct 3
cities? Have you met with any of the cities in precinct 3
I have
yet?
I have not. Mayor Trevino is actually on the COC Leadership Council, and he is helping me set up cluster meetings. Actually, I think that will align with your precincts. And then really soon here, we wanted to get past July and August, kind of the summer, but Mayor Trevino is helping me with that.
Okay.
And I think what's gonna, again, what we're approving today, this 32.5, correct me if I'm wrong, will be used for a call for projects. And so the intent there is for Lauren, for Kristen, and that group, to meet, to let Oscar set up those cluster meetings with the cities and to encourage them to look for, look to make applications for these calls. And that's the way we're gonna get this money spread out all over the county and not specifically, in one concentrated area from that standpoint. So everybody, I think Oscar will make the attempt to meet with cities in each one of your precincts. And I think he's already, talked with some of the folks maybe in precinct 3.
Okay.
Who's chairing the mayor's council now, Glenn?
Who is the mayor's council? Who's chairing the mayor's council?
Oscar.
Oscar is the chair now? Okay, it's Oscar Trevino from North Richland Hills.
So that's an excellent place to start.
Yeah, well, and Oscar's the one that's trying to put together those cluster meetings. So I think that will do exactly what everybody I think wants, and that's their cities within their area to be made aware of the grant possibilities and help and assistance with doing that.
Well, our issue tends to be, or what I've been told, is high school kids, basically, junior high school, who are not, they're living in automobiles and stacking up 3 or 4 or 5 of them in a hotel room or at somebody else's house. They're not at their house. And so.
And that kind of, you remember earlier I asked her about the fact that the 3 definitions were HUD definitions. And there is conflict between the definition of homelessness for HUD and homelessness for the schools. And so to that end, I think what hopefully these cluster meetings will do is to provide some opportunities, some grants that will maybe combine not only the homeless under the HUD definition, but also the homeless under the schools.
Department of Education.
Yeah, for education. So your point is, you're right. I mean, I think we've got people living or what they call couch surfing in some of the suburban cities.
Well, and I can just say, I'll connect with your office. Our community last year actually received an award specifically to serve 18 to 24-year-olds. So in October, we'll have about $3 million of new money coming in specifically to serve that group. So I'll make sure and get with your office on how to best connect there.
Okay.
Other questions of either Lauren or Kristen?
Good job.
Thank y'all for your work. Now, we need a motion to approve this $32.5 million.
Yep, that's why I'm coming up. That's the follow-up. So yes, if we could, we're requesting the court approve this program as presented to allow staff to work on an RFP.
So we have a motion and a second. Any further discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you.
Thank you.
So, members of the court, now that we're past item number 2, we're going to go to just touch on a briefing item we mentioned before, and this is a question that the court raised during a budget hearing, and it concerns school-based clinics. And Dr. Duncan is here to address the court at this time.
Good morning.
Good morning.
Members of the court.
Good morning, Dr. Duncan.
Before I get started, I was not aware that Ms. DeBose was going to join us today, but if I could take this time, Ms. DeBose, Dorothy DeBose, if you would stand, who I refer to as Madam Chair of the hospital board. She chairs our hospital board. I'd like for all of us to join in congratulating her on being named the 2022 recipient of the Dallas-Fort Worth Hospital Council Kearney Leday Award. She will be honored in person October 21st. More to come around that. Some of you, I'm sure, will be invited. But thank you for giving me that opportunity and recognizing the great work she's done for JPS and also for the community that she serves. I was asked to come speak a little bit about our school-based clinic. I'm actually going to let Joy Parker, who is our Vice President of Community Health Service at JPS, speak to you about the school-based services. I want to really start off by saying that this is really a great template and future role model for how partnerships can come together to improve the health of our communities. And this is a partnership between the Tarrant County ISD, JPS, and Cook Children. Just to remind the court, about 5 years ago is when we started this conversation. At the time, JPS was in trailers in school districts. It was only a handful of schools in which we were within the four walls of a school. And we started to see here in Tarrant County, also in Dallas and across the nation, the use of telehealth in the schools themselves. And we saw this as opportunity to expand upon our program and approach the ISDs at that time and approached the two premier children's hospitals in the DFW area. These conversations went on over a couple of years, and I have to say, as we began to start to see the ability to expand pediatric care in our communities and started to work together, that we were well prepared when COVID started. It wasn't our reasons for coming together, but when schools were shut down, when kids were sent home, to have this partnership in which we were able to continue to provide pediatric care in our communities was instrumental. And so I'm going to let Joy speak about the school-based partnership. I only wish we could have come to you before the recent article hit the papers, because the true headline is creating health equity through strong community partnerships, and I think you will hear that today. Joy Parker is our VP of Community Health Services. She was at Dallas Children's Hospital for a number of years and led their home health program. She does a lot of work, including the homeless work that you heard about earlier. She's also been instrumental in partnering with the Public Health Department, and you heard Vinny speak about the 14,000 immunizations that have been given by the Public Health Department. To date, in the back-to-school efforts, JPS has given over 17,000 immunizations. And so really this partnership does allow for increased access in creating health equity in our communities. So without further ado, I'm going to let Joy speak, and I think you'll be quite impressed with the program. Thank you.
Thank you. Thank you, Dr. Duncan.
All right, good morning.
Good morning. Good morning, Joy.
And, it's my privilege to serve under the leadership of Dr. Duncan. I've been with her for the 5 or 6 years that she's been with JPS, and this leadership and this creativity and recognizing, I think, what we have all learned and was heightened during the start of the pandemic is that we are stronger together, that we provide better services when we partner together. And JPS is proud to partner with our school districts as well as Cook Children's and many of the other speakers who are here today as we look at taking a holistic approach to the needs of our patients and their families so that we can provide better care and services. So hopefully the court, you have a presentation that was provided. But this story and this journey actually began back around 2018 pre-COVID, as Dr. Duncan mentioned, as we looked at models of care around the nation that best suits students and their families. At JPS, we continuously assess our services to make sure that we are providing the best care that we can. And so that means looking at current models of care and saying maybe this is what we've done in the past, but where are we going in our future? And what does that look like? And so as the conversation for telemedicine services embedded in schools became the conversation, we did begin that journey with the leadership at Cook Children's, recognizing that they are the premier provider of pediatric healthcare services in our county, and that there is a great opportunity to leverage the expertise and strengths of both of our organizations to improve that quality of care and access across the lifetime.
What they're trying to make sure of is that you remember you got that clicker and you got to click remove the stuff. Everybody's coming up to help you on this deal.
I apologize, not everyone has the presentation. I brought 12 copies. That's not enough for everybody.
I'm actually the technology guy for the county.
This is the scariest thing that we've got.
All right.
Nice try, GK.
Yeah. Oh, so thank you so much. I get excited. You can tell we're excited about this partnership, and we want to continue it forward. But here you see two, at Cook Children's Neighborhood Clinic and our Northeast Medical Home. And as you know, we're excited about the work and the effort of expansion. And I think everyone here has seen that the medical home model really best meets the needs of our patients. And so comparatively speaking, when we're assessing our operations always, the JPS previous school-based clinic model of a portable trailer outside of a school within a school district provided a service. But when we looked at a partnership where we moved that care into a JPS medical home or a Cook Neighborhoods clinic, it opened up the doors to more resources. It provided on-site support for pediatricians, pediatric subspecialists, as well as many of our partners who are here, case management. So when a patient or family says, we have issues with food or we have issues with housing, there's on-site support in that space to provide resource. During the pandemic, we did identify that we needed more space to safely social distance families in waiting areas, infection prevention, screening at the doors, to make sure that we first and foremost provide safety. In the JPS medical home in this partnership and a Cook's Neighborhood Clinic, it afforded that ability. But we know that we do not make decisions in isolation. We started this transformation process, and here's a map of all of our different sites, with our superintendents at the school districts. Our CEO began at that time having regular leadership meetings, sharing the information that we learned about best practice with telemedicine, with partnerships with pediatric specialty and other support wraparound services for our patients and their families. To date, we still maintain regular, ongoing leadership meetings with the school districts. Their leadership meets with our leadership. We have dedicated JPS and Cook Children's ISD liaisons that are available 24/7 for any needs that are identified. As we look to do some of the different outreach efforts, which you'll see some pictures in a moment of that for vaccination efforts in the community, we partner with the schools to see where those gaps are. And I'll show you some of that information on the last slide. Not only are we committed to providing care and services for our students and their families, but we are dedicated to the ongoing education and support of school nurses in their care of a medically complex child. Both Cook Children's and JPS, we support with pediatricians that provide ongoing education and in-service training on the medically complex child, on the child that has asthma, on the child that has diabetes, and any of those needs. And we maintain a regular open communication for any questions that come. So not just the student that has a need real time, but any questions around that education and best practice. Our clinicians sit on panels related to the Asthma 411 project. As we know, asthma is a leading cause for students to miss school. And here you see some of the outreach impact that goes beyond what we do in the four walls of a medical home, because we are committed to bringing care where that care is needed out in the community. We're very proud our JPS Acclaim sports medicine program, and we are a teaching hospital in partnership with TCU, provided over 1,400 free sports physicals at an event. In addition, we have, and I could have slides and slides, but I did put a flyer in here to show you. We have had multiple outreach efforts at back-to-school events, for vaccine outreach events across the community. We've partnered in the 76104 area for car seat checks with our Fort Worth Fire Department. We've done multiple COVID vaccine events, as well as dental screenings, and also providing behavioral health screening, enrollment and eligibility personnel to help patients connect to affordable care in their communities. I know my esteemed colleague, Tanisha Kennard, was here. We partner very closely, obviously, with our school districts around behavioral health and the growing need that we see within our student population. And she spoke about TChat and what our JPS team is doing in partnership with our colleagues such as Cooks and others around behavioral health services for our adolescent population. Here's a little flyer that was circulated that kind of shows some of the dates, and I apologize, it's so small. But it shows our most recent, just in the month of August alone, we've had about 6 outreach vaccine efforts on both weekdays and weekends after hours to meet the needs of our families so that we could, again, in support, help these children make sure they've got what they need as they get ready for back to school. And a picture is really worth 1,000 words. And because I could only, I know that I was told to have just a limited amount of slides, I just put a few of our most recent. But here you see really the people that, if they were behind me, are JPS team members and care providers that are out giving vaccinations, connecting people to care, helping with testing. So this is them and their effort and their passion for our community and our kids and their families. Thank you for letting me come and speak about this collaboration. And I know that we're really proud and certainly excited about continuing forward and advancing care for our community.
I want to thank you and Dr. Duncan and Madam Chair. Congratulations for this presentation this morning. When we read the article in the Star Telegram, it led us to a false set of conclusions that we were cutting back on our services to the school districts, which, according to this presentation, could not be further from the truth.
Yes, sir.
I applaud the expanded outreach efforts. I applaud the use of technology to serve more children. I applaud the coordination with school districts across Tarrant County to try to meet the needs of individual children where they are in communities. You get married to the old ways of doing things, and sometimes it's a little difficult to transition to new ways and methods. I I think it would have been better had we had this presentation before the Star Telegram article, but it's never too late to educate this court, to bring us along with you, so that we can defend you, so that we can advocate for what you're doing. We can't do that if we don't know.
Based upon the speed of some of the fingers over there, maybe there'll be another article in the near future.
I would like to, I'm kind of brought that to y'all's attention, or some of you attention, the article. And I think what my biggest concern was, and I love what you're doing, okay, the deal with cooks, that makes a lot of sense.
All the sense in the world.
But
Yeah, you ain't going anywhere yet. Get back up here.
She knows all the information.
But it took 4 years for somebody to bring it to our attention, which makes us look bad. Which, to some extent, it reflects on, there's a lot, there's a communication breakdown, and Dr. Duncan, you weren't in charge. You know, we had somebody else running the hospital, and so I think maybe blame is not the right word, but at least notifying, and 'cause I was very proud of the school-based clinics that we had in Northeast. I talked about them to, every time I got into a meeting, it was part of my presentation, talking about, you know, what is JPS doing in our area? Because they don't, you know, we had one clinic when I became commissioner. And I mean, and now we still only have two, but we had those school-based clinics. And I never had a problem with the way they were operated or run, and the philosophy behind running them. And I just wish somebody had come to us and said, hey, here's what we're doing, and we're working on this, and we've been working on it since 2018. So I just wish we'd have had that communication open.
And I want to be sure that I understand, but as I understand what we've just said in the presentation, we went from the clinics that we had where we had actual people on campus, maybe out in a temporary building, but we had them on campus, to where now the nurses, which we have one in all the schools, the nurses have the ability to hook the student up and to communicate basically in every school, in every district. They basically can talk to multiple physicians depending upon which ones they are in need of in that particular occasion. Is that?
Yeah, so we continue to work with each school, much like we do with TCHAT, to discuss these opportunities and to provide these opportunities. And so currently not all schools do have a telehealth platform, but we continue to reach out to all of the school districts so that all of the schools will have telehealth available.
But we're expanding that
Yes.
and we were able to expand it significantly as a result of this, I guess, ongoing collaboration that has been developing over 4 years. And that's back to what Commissioner Fickus was saying.
And I'm hoping you're utilizing Cooks. Cooks has clinics all over the metro,
And that's
all
what,
over
if you
Tarrant County.
Yeah, if you see the access now that Joy showed you, they really did open up access.
Right. So
And,
I
you know,
hope we're
a child now goes to
utilizing
their
those
closest
facilities.
access, not to a JPS or a Cook clinic. They go to their closest access.
It's a good and logical collaboration to serve our children.
So I'm gonna add some additional feedback, and I see this list here, and I think just because of the resolution, even on the electronic version, it's very hard to read, so if we could be directed to the website for where the listing is, or be sent that document, then that would be great. I would say, and this has been said by my colleagues in different ways, but this is one of the examples of a best-kept secret that everyone needs to know about, and I know that that has been, at least from my perspective and being on the court just over 3.5 years, that's been one of my largest concerns with JPS is how we're communicating out to the community. So I think what we're all saying is we definitely want to be equipped with the right information so that we can help to spread the news of the great things that are happening at JPS, but then also so that people are connected to resources. I would add that I really appreciate seeing this list of your outreach efforts and your transformation work. And if we're talking about being responsive to our community, a very diverse community, I'm going to ask that when we provide information in English and Spanish, that we also add in Vietnamese. This should be at a minimum a matter of course, since those are our 3 most prominent languages spoken in Tarrant. And I'll say when I learned of the article, that it didn't sound right, and then, we talked about it very briefly. So I'm glad to have learned about all the great work that's being done. It's really strong work. So that's all I have.
Again, thank you, and we hear you. We take your suggestions to heart, and I think what I heard was that it's okay to brag on the great work that we're doing. So thank you.
Thank y'all very much.
Nice
now,
to meet
we
you,
are going
Joy.
to talk about your tax rate in just a minute. So.
One more thing about Madam Chair's award. This is a big deal.
Oh, yeah.
I knew Kearney Leday. I knew him through his service with brain freeze. Texas Health Resources. I knew him when he chaired their system-wide board. This award recognizes board members all over the North Texas area. And for our chair to receive this award named for Kearney Leday is a heck of a big deal. So congratulations, Madam Chair. And I said as much in my letter of recommendation for you.
Go ahead, sir.
Thank you, Your Honor. Members of the court, we can go now to the administrator's item number 3. This is action concerning the submission of the Tarrant County's no new revenue and voter approval tax rates for tax year 2022. Discussion of proposed tax rate for tax year 2022 and take a record vote as it relates to those rates. So what we're requesting at this time is that the court members take 3 actions. The first is that we receive and file the proposed no new revenue and voter approval tax rates for Tarrant County, which are shown in your court communication. Also, then we ask for action concerning the proposal for a tax rate of 0.229, which is the current tax rate for the tax year 2022, and take a record vote. And let me make a quick comment on that. That is the outside rate, so that you can always come back.
That was my question. That's
Yes,
what we used to call the outside rate.
Yes, sir. And what that'll happen is that we'll come back to you on September 13th for the final rate. I know that there are some items that the court still wishes to discuss. The major one is the funding of the public health department, and it gives you various options. We do ask that you take a vote on this one since it's the outside rate, and you can come back and do a lesser tax rate.
We can always lower. We can't go above the 0.229.
That's correct. And then finally, because of the various rates, we're going to ask that that we hold a public hearing on September 13th, 2022, at 10 o'clock in the morning of the Commissioner's courtroom. This is the same date and the same court session as relates to when we set the tax rate. And if you all are in agreement with that, I believe that we can cover all three of those issues with one motion and one vote.
So moved.
Second.
We have a motion and a second, and again, I just, this is the outside, this is the highest that we could go, and I think we are going to talk, and we may talk a little bit more as we move into the budget, but, we did talk about, as Mr. Manius indicated, maybe moving the public health over. I know I talked with some of your board members. I know that y'all have already passed on the board level, you've already passed your budget. And so I'm coming of the opinion that if we're going to do anything, maybe we need to do that or consider that into the future. And so as we talk about that, I think my preference is going to be to leave it over there this year and potentially cut the tax rate at the county, but we can talk about that in just a minute, maybe from that perspective.
I think Dr. Duncan shook her head.
Yeah, I hear you. I think I hear you. Any other discussion at this time? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
So members of the court, we can now go to item number 4. This is basically the same discussion, except this is not for Tarrant County government. This is for the Tarrant County Hospital District. So we are requesting that the Commissioners Court take the following actions. To receive and file the proposed no new revenue and voter approval tax rate for the Tarrant County Hospital District. Propose a tax rate of .224429 for tax year 2022 and take a record vote. And once again, this is the current tax rate for the hospital district. And then and then to also call a public hearing for September 13th, 2022 at 10 a.m. in the morning in the Commissioner's courtroom. We do have in the background of the court communication, you see the various rates for no new revenue, voter approval, current rate, and proposed tax rate. And if you are in concurrence with all three of those recommendations, we believe we can cover that with one single vote of the court.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
So members of the court, if we can continue with the administrator section, move to action item or to item A8. This is the request that the Commissioners Court approve the sheriff and constable fee schedule for calendar year 2023. Just to note, there are no new changes. Russell on our staff worked with the budget office, constables, JPs, sheriff's department, district and county clerks, the criminal district attorney's office, all as it relates to this proposed fee schedule. And as I previously said, there are no changes from the current fee schedule. We're asking the court's approval at this time.
Move approval.
Second.
We have a motion and a second. We do have a public comment on this. And I would just, remind the folks, we encourage the public comments, but please be familiar with back and basically our rules of decorum. Mr. Torlincasi, come on down.
Judge Whitley and commissioners, public servants and citizens and taxpayers, absolutely we should follow civic decorum, and I would need the chair's assurances that my physical safety is guaranteed while I make critical comments about this measure. Do I have your assurances that I'm safe?
You go ahead and make your comments, and as long as you hold to the decorum of this back message.
All right, well, the two men who assaulted me on Friday are in the back of the room. They're supposed to be the security in the building. I don't want to put a shade on my free speech when I criticize the sheriff's department with regard to this fee schedule specifically. So I have 2 points to make. You're approving the fee schedule for the sheriffs and for the constables. I have no issue whatsoever with the constables, but my point to that is that because it's possible for a single commissioner or the entire commissioner's court to have an issue with the fee schedule, say for the sheriff's department, that this particular measure ought to be broken out into 2 votes. and because that's my second point, which is directly related to this agenda item, so you don't get to say I'm off subject. My suggestion is that you split it or table it, and that you suspend the entire fee schedule on the Sheriff's Department until somebody investigate what's the heck's going on over there.
Thank you, Mr. Torrencasi. Is there any further discussion?
Staff recommends approval.
We have a motion and a second. If there's no further discussion, please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Ms. Tidwell?
Hello, Judge. Good morning.
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 I have two items I'm asking the court to consider. The first is the release of the $26,799,000 of collateral is outlined in your court communique and is in the attached documentation.
Move for approval.
And that would include the substitution of the additional items, just to make sure that's clear.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
And the other item, we're asking the court to receive and file the auditor's report related to the sheriff's bond desk system upgrade. And I would just note that we did feel that this is a significant risk as it related to the ability to make voids and not have necessarily those voids and adjustments showing. And I'm certain that IT is working with the Sheriff's Department, but I would point out that that is a significant issue because it would allow misappropriation of funds potentially to go undetected. So we're asking you to receive and file that report.
Move to receive and file.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Otter.
Good morning, Judge, members of the court. Today we're asking the court to approve an order calling for the general election to be conducted on November 8, 2022. This is a requirement of the Texas Elections Code, sections 3004 and 3005.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Thank you, sir. Mike, come on down.
Good morning, Your Honor, members of the court.
Good morning.
Morning, Mike.
We have one item for your consideration this morning. An approval of a professional services contract with GSBS Architects for architectural and engineering services for the third and fourth floors renovation project at the 350 West Belknap building for the amount of $863,090, and this project has been recommended for Arpa FR funding.
Move for approval.
Second. We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you.
Ms. Glenn?
Move to receive and file personnel agenda.
Second.
Second.
We have a motion and a second. Mr. Torrencasi, did you put in I think it indicates it was 10I. I'm not sure whether it was 1 or 2. Okay. Come on down.
Judge, I think those are both sheriff's office items, not human resources.
Well, it says it says 10I, 1 and 2.
Right, that's the sheriff's department.
Well, I've got 10I as human resources.
10L is the SO.
Well, it may be, but he put down I.
That might be my reading glasses, I apologize.
Okay, so
It is L that I'm interested in.
you're interested in L. Okay. So we have a motion and a second on the personnel agenda. Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you, and good morning. We have
one additional item for the court. That's item number 2. We're asking the court to approve table of organization changes for the Public Health Department. And this information is provided, of course, in more detail in your court communique. But in summary, this is a 2-part request. The first part is for the creation of 10 informatic positions that would work under the Public Health Disparities Grant. All 10 positions have been evaluated by the Job Evaluation Committee, and their respective pay grades and duties are outlined in your court communique. That's the first part of the request. The second part is the court's approval to adjust the hiring rate to minimum plus 20% for 2 division managers in the public health area. The reason for that request is that those 2 incumbents have assumed more nursing responsibilities because of the nursing shortage that's being experienced in public health. So lastly, I will say that the fiscal impact for the creation of 10 positions is $994,069 and some change. And then for the adjustment to the hiring rate, that's approximately $6,496, and that would be covered by the Public Health Fund TO 400.
Move approval of both items.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you.
Wait, before you, well, this question may be for you, GK, but it's regarding HR and the discussion that we had, I think that was last week, about the coverage of certain women's health services under our plan.
Yes.
So any update on that?
So we sent you, I'm sorry, we have sent you an email on
Okay.
that. And what we will do, Tina, let's just go back and
Sure.
copy all the court members.
Will do.
Okay. I missed that, so
Basically,
my
the
bad.
plan hasn't changed any of that. Our current
Good.
plan has not changed any.
Very good.
That's
Thank you.
correct.
Okay, thanks.
Melissa, come on down.
Good morning.
Good morning.
Morning, Melissa.
We have 8 items for your consideration. The first item is regarding bid number 2022-202. This is for the sale of recycled paper plus 20-plus tons of sorted white ledger and 20-plus tons of sorted office paper for facilities management. The recommendation is to award to the high bidders Evergreen Fiber Sales for the sorted white ledger and Texas Recycling for the sorted office paper.
Move for approval.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
And the second item is regarding RFP number 2022-103. This is for Youth Advocacy Services for Juvenile Services, awarding to Youth Advocate Programs Incorporated in the amount of $600,000. And if approved, we're also requesting contract approval.
Move for approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
The third item is regarding RFP number 2022-120. This is our annual contract for self-insured workers' compensation program, claims administration, cost containment, 504 program administration, and medical case management for human resources, awarding to the various primary and secondary vendors listed per the terms of the contract. Also, we're asking for contract approval and acceptance of the surety bond.
Move for approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
And the fourth item is regarding RFP number 2022-128. This is a contract for Family Preservation Program for Juvenile Services. This is Arpa funded, awarding to Lena Pope Home Incorporated in the amount of $265,000. We're also requesting contract approval.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
The fifth item is regarding bid number 2022-174. This is our annual contract for purchase of PC law time matter support and maintenance for information technology, awarding to Carasoft Technology Corporation in the amount of $59,073.75.
Move approval.
Second. We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
The rest of the items are also ARPA-funded items. These are all renewals. RFQ number 2020-102 for juvenile residential services, awarding to the various vendors for our second and final option for renewal. We're also requesting contract approval.
So for these are 7, 8, and 9 are all ARPA, and they're all contract and approval, so I might take a motion.
Yeah, they're all renewals.
For all three of those?
Yes.
Move approval of all three renewals.
Second.
We have a motion and second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motions pass unanimously.
Thank you.
Thank you, Melissa.
Move things right along there, Mr. Maines.
Melissa will be presenting the administrator section next week. Members of the court, we can now go to item I, which is the Sheriff's Department, item number 1. These are the two that came off of consent. We're requesting that the court approve amendment number 2 to the ILA between Tarrant County and TxDOT for the Courtesy Patrol Program. The only change was that we had originally approved amendment 1 on the 26th of July, and TxDOT signed on the wrong line. So we're just...
Well, you said item I, but I think it's item L.
That's
you
correct.
have the same
It's these
glasses that Torlincassi was using back there, so.
Thank you for pointing that out, Judge. Appreciate that. It is the
Okay.
Sheriff's Department, L1.
L1.
So staff is requesting approval of this amendment.
Move approval.
Second.
We have a motion and a second. We have audience participation on both items 1 and 2. So, Mr. Torlincassi, item number 1.
Yeah, it looks a lot like I or L. Just depends.
He agrees with you.
That's right, it does. I just should have looked at the K first. Judge Whitley, commissioners, and public servants, especially our law enforcement public servants. Judge, you declined to protect my First Amendment right to not be intimidated when I'm critical of government. I pointed out that my two assailants are in the back of the room, Deputy Orozco and Deputy, this gentleman right here is Orozco, and this one, I have his name. I'll be filing a complaint against both of them. It is tough to stand here and be critical of the Sheriff's Department when two of the sheriffs who assaulted me on Friday are sitting in the back of the room providing security, allegedly. I'm going to go to the measure. Obviously, I'm going to be opposed to this, and I'm going to tell you why. The employees that do the courtesy patrol are probably easily the most courteous sheriff's employees in the county. They help people on the side of the road. They help people with flat tires and move obstacles out of the way. My suggestion, like I made before, is the Sheriff's Department needs to shrink back and get a lot better at its core responsibilities. And the staff members that ride around and do these courtesy patrols are desperately needed at Tarrant Appraisal District and in a lot of other settings where they recognize that the taxpayer and the citizen is their boss. Regrettably, this is a fluffy thing compared to the core responsibilities of the Sheriff's Department. And I believe that the people who run around and do this in coordination with the Transportation Department could teach the entire Sheriff's Department how to be courteous, professional, cordial, and respect people's civil rights.
Is there any further discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Members of the court, we can now go to L2. We're requesting that the Commissioners Court approve the First Amendment to the FY22 Texas Victim Identification Notification Every Day, or the VINE program, statewide, as relates to that contract with the Texas Attorney General's Office. This amendment is one that's been requested by the Attorney General's Office. It simply revises the name of the vendor certified to provide those services from Apris Inc. to Apris Inside LLC. Staff is requesting approval.
Move approval.
Second.
We have a motion and a second. Mr. Torlincassi.
Judge Whitley and Commissioners, similar point on this specific agenda item. As a recent crime victim, although it's unadjudicated yet, it would be nice that if the notification system included the ability for crime victims of law enforcement to be made aware of when and if their assailant or their perpetrator was in their space. Similarly, if law enforcement gets a minor infraction for their conduct towards the public, we should be able to know what department, what county that they have moved to.
Any further discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Are there any appointments today? Commissioner Johnson, I see you have an appointment for the hospital board.
Yes, sir, I do. We're going to be losing, excuse me, Dr. Charles Chuck Weber. And I would like to do a promotion for him 2 weeks from now at our next meeting.
What's he doing there?
In his place, I would like to appoint, he's moving to Austin, or down near Austin. The appointment I'd like to make is Margaret Holland. She's an MD and JD, and I think will make an excellent board member. I've had good recommendations from a lot of people about Margaret and her professional ability. So I will make that my appointment.
I will second that. Second that motion. She appears to be an outstanding addition to the board.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
And I have an appointment. I need to appoint Tracy Williams to replace Jay Jackson on the Tarrant County Variance Appeal Board. Thank you, Natalie, for the reminder.
Second.
We have a motion and a second. Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Court members, you have before you the claims, including the addendum.
Move approval of the claims, including the addendum.
Second.
We have a motion and a second to approve the claims, including the addendum. Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Briefing items, Mr. Manius.
Thank you, Your Honor. Members of the court, if we can go to item C. This is the 2023 budget issues. There are various items that we would like to discuss with you today. So, Helen, I think you may want to start by telling them a little bit about what we have yet to decide on the to-be-considered list.
Right. They're
Yeah.
here.
Oh, listen.
Oh, we're not done?
Could we get the mental health people out?
You know, yes, we can.
Before we get bogged down in budget?
Yes, and I apologize for that. So if we can now go to item B, which is the Mental Health Jail Diversion Center update. Ramey is here to discuss the court, though he loves to spend time in court with us.
I was wanting to see if I could say good morning or good afternoon. I wasn't sure where we were going to end up. But
Well,
thank you.
you started and you end by this afternoon. And
That's
we'll be, if you still end in the morning, we'll be even happier.
We'll make it quick. No, thank you for inviting me here to discuss the mental health jail diversion center. We're giving a June and July update. Since we last met, Judge Whitley called a meeting of the advisory committee. Commissioner Brooks was there as well. Our main topics are the census at the facility. If you look at the report, we can talk about the report, but we had 12 in June and 14 in July. Those are the numbers, the total census for the month. So that remains an issue. So we had discussion, part of the discussion was what to do about that. One of the topics was maybe the offense right now that is eligible is criminal trespass. So there was a discussion about maybe broadening that. The conclusion, at least at this point, is we're going to remain and continue to use, if the person potentially could have been arrested for criminal trespass, that's where we're at. We're going to continue with that. I think there's still opportunities there to increase the numbers. So any encouragement from the law enforcement in your areas, your precincts, that would be great. We're going to continue to work. The DA's office we met with them. They're going to continue. They're doing some additional marketing and visiting with police departments and training on that. We continue to promote it through our law liaison program in all of their trainings, and even because we have the 24/7 hotline. When officers call, we will mention and promote that when it's appropriate. Also, Councilwoman Beck invited us to a meeting with her neighborhood police officers at the end of the month, so we're going to participate in that. So we'll continue to participate where it's appropriate and promote where appropriate, because we definitely like to see that census come up. If you look at the report, I believe you have a copy of the report, and it shows the census and continues to give just the areas. I don't know if you have any questions about that. We continue to pursue enrolling as many people as possible in JPS Connections, and obviously for housing, substance abuse, follow-up mental health care, and medical care. So, any questions about that report?
I do have one question.
Yes, ma'am.
Just, I think the last time you all made an update, I was curious as to if we've noticed any particular trends, like based off of the ratio of male to female or anything like that, which at that time you'd explained to me that the numbers of the female patients to male patients closely mirrors the numbers of those who interact with the criminal justice system, but any trends or high-level trends from these numbers?
That in particular, I was looking just at the total for the year. The numbers are so small, but we had pretty close in July, 6 and 7, so it was fairly close, male to female. So we'll continue to watch that. I mean, it really, this continues to be the officers, the way they choose who they bring in, and most of them are coming from John Peter Smith Hospital District. The Sheriff's Department is bringing in quite a few folks, and also Fort Worth has brought in 20 for the year. So those are the bigger numbers. But we'll continue to watch that. But it's some of our success stories involve ladies who come in, and I think they're the most vulnerable individuals anyway out on the street. So.
Sure. And then my second question is, oh my gosh, it just fell out of my head. Hold on, give me 1 second.
I just love it when it happens to a younger person.
If you remember it, we can definitely come back to it.
Welcome to our club.
Right. Oh, I did. Okay, I remember what it is, and I had briefly talked to Chandler about this, and I think he was checking to see. I don't know if he's here today. But I wanted to make sure that I understood the law enforcement agencies that were all included and it could bring in folks. I guess that's countywide, but with the start of school in particular, I can't help but to be concerned about Tarrant County College District, or in my precinct, it's TCC Southeast Campus. If they have their own police department, have they been educated on this, as well as UTA? They have their own police force, as I'm sure other universities do. But have they been engaged in this conversation? Hey, Chandler, have they been engaged in this?
In this process?
Yeah.
We haven't personally done out of the DA's office. Have y'all gone to those to the TCC
colleges and
campuses
universities.
and others, when the police departments, when they were doing the education piece.
So we are working on our education piece right now because we're doing it electronically so that we can get to each agency's roll calls.
Okay.
That way we can actually get the communication with the officers who are making those decisions on the street.
Okay.
We have not included in that our work with our universities, but the email that we send out goes to all the chiefs. We include our law enforcement chiefs at the universities, and I'll make sure that we do that today.
Okay, great. Thank you so much.
And if there's any particular invitation, we'd be happy to meet.
Okay.
Talk to anybody that would like to.
That
as
sounds
well.
good.
And we did get, I think we had one from the Southwestern Baptist Theological Seminary brought someone in at one point. So we were glad that they were involved and knew about the program. So
Yeah.
I think the word's out, but
Good.
more continuing needs to be done. I just look at this, like when we started the law liaison program, it took some time
Can
to
take
get
time.
everyone educated and up
Yeah.
to speed on the program, so.
Yeah.
that's
Raimi,
the
I
question.
thank you and Susan for this report and for your ongoing stewardship of the Mental Health Jail Crisis Diversion Center. I continue to be concerned with the low census. I hope that the ramping up, the reinforcement of marketing efforts will bear fruit in raising awareness among the various officers that patrol our streets, that this facility is available, and to also let them know that their chains of command support bringing people to this center. They've got to know that it's okay not to arrest someone, to take them to this center for treatment rather than incarceration. And unless they hear it from their brass, they may still have some unreadiness when it comes time to make that decision. And I want to help remove that unreadiness from the making of that decision, and for them to know deep in their heart of hearts that this is a good decision to make and that it's okay with their leadership that they should make this decision.
Absolutely, absolutely.
Well, I hope that their leadership also, as they work together, as we said, we hope this becomes much more aware to the police officer on the beat to make that decision or to make that choice. But, the police forces may decide that they want to expand this. And, I think we want to, give them every opportunity to do that and give them every benefit to make that choice.
The door's open 24/7.
Yeah, and that's it.
It takes about five minutes to get in, for an officer to get in and out.
Yeah, and so I think, if they can be, if they can talk and say, hey, look, we feel comfortable with this additional, other than just the criminal trespass, then, I would encourage that to happen also.
When we started planning this center, we said that at some point we would expand beyond criminal trespass. We're only 8 months in, 7.5 months in. Maybe that progression is not yet mature, but we will get there, I'm certain, at some point.
Yes, sir. And I know one of the things the advisory committee was doing was looking at the data on who's arrested in the Tarrant County Jail with criminal trespass, how many of those have mental health issues, to see if there's some way we can use that data to help encourage some changes. So that's being worked on as well.
We reserve the right to expand.
Absolutely, absolutely. One short, I'll just make it short, but one success story. A patient was brought in with acute symptoms, paranoia and depression. She was stabilized in the facility transitioned into a group home, and connected with our supportive employment program. When she returned upon completing the supported employment training, she was dressed professionally and reported she was working on renewing her driver's license. She was placed in a leadership position at her group home and was given a list of responsibilities, and it was a paid position. She was very proud of her role. She reported she was thankful for the Mental Health Jail Diversion Center for helping her to get going again and have another chance at life. So I'll leave you with that one.
That's what we like to hear.
Sheriff, would you like to make a comment?
Just wanted to echo, I think the diversion center is very successful. I think the staff is incredible there. I believe the chiefs are on board from the various agencies. I've reached out personally to some of them. I think Sharon's doing a great job of getting the roll call training, and that's really what it's going to take, because often the officer on the street is confused with what he's seeing. Is he seeing intoxication? Is he seeing somebody on drugs, or is he seeing mental health? So all those decision matrix are going through there. So hopefully we can help them. It's brand new. I think just a few more months and it's going to become a regular mindset. But I just want to let you know that the policing leadership in Tarrant County is on board with this.
Thank you very much. Appreciate that, Sheriff.
So, members of the court, we can now go to item C, which is the 2023 budget. There are at least 5 issues that we have yet to discuss.
Hey, GK, I'm sorry to interrupt you. I can't hear you.
I can't either.
Let's try it again, okay? Can you hear me now? Something's wrong with my mics, I'm sorry. Okay, so.
You don't know how much we had to pay somebody to take care of that.
Yes.
Good response, GK.
So there's several items that had not been covered yet, or had not been resolved yet, but I would like to see if we could maybe focus on just a few of those now, because we still have some items that, or some court dates that we'll be meeting with you all, the 30th, and then the first week in September to finalize a lot of things. But there are some things that are somewhat time sensitive, at least in my mind, and I don't want to stop the budget director from having her comments, but the two that I'd like to talk about, and maybe 3, would be the, we have to post by the September 2nd, the salaries for certain elected officials. I believe that Helen gave you an email last Friday as it related to that. And we had been looking at either a 7% increase, which consists of 4% market and 3% merit, as we have done with all of our other employees, or if that was something where we wanted to limit that simply to the merit increase of 3%. There are some issues that
I think we pretty well, I may be wrong, but I think we pretty well discussed that last week. In Angie's discussion, it was the 4% plus the 3% for everybody. And I know that there are some elected because of state law that cannot receive any increase whatsoever.
I was not talking about the employees. I'm speaking only of
elected officials.
So we're just asking for direction on that. Just a thing to note, there are a lot of employees that are tied to as a percentage of certain elected officials.
And that's the point.
I agree.
So many employees are indexed to our salaries, and if we don't get a raise, they don't get a raise.
That's correct.
So I would take the full allowance that's available, so that those who are tied to us get the full benefit of increases in salary.
So that's the decision of the court. If we can just get a motion on that, and that way we'll move forward with the publications.
So moved.
Second.
This is just for the purpose of making the notification for the publication, right? Not voting for or against the elected officials getting raises?
Correct.
That's correct.
Okay.
Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
So, thank you, members of court, and did you have any comment on that? So, the second one deals with the 323rd District Court. That is the court that hears juvenile cases in Tarrant County. As you might recall, the Commissioners Court authorized us to enter into a contract with Mr. Kerry Cockrell. That was something that we did to evaluate the juvenile center, the detention aspect of it. One of the main driving reasons was because of the increase in population and the demand for additional probation officers that were confinement probation officers. And so that report has been issued. We have made that available to the members of the Commissioners Court. We've worked in conjunction with the Juvenile Board, and all the members of the Juvenile Board and their attorneys have also received a copy of that report. And we're here to discuss the report. If you would like to do that, Mr. Cockrell is here in the audience to answer any questions. So you have that report, and if you would like to discuss it, since it's a budget-related issue, now is the time to do that.
I've got a couple of questions I'd like. I see Curly back there, so if he could go ahead and come forward.
Mr. Cockrell, will you come forward?
Just again, as a reminder, for the fact that many of y'all haven't been around since Mr. Cockrell was here as an employee. He was the director for Tarrant County for 20 years, 20 plus years?
21 years, sir.
And then from there, when he retired, went to the state and headed up the effort there for a couple of years. How many? Time flies when you're
About
having fun.
4.
Yeah. And then went to Kentucky.
Yes, sir.
And did they, in addition to compensation, keep you well supplied with bourbon?
They didn't, but I did.
So I appreciate very much you coming forward. I appreciate very much the effort. I mean, again, we were looking for something pretty quick, and I figured that certainly someone who had that kind of experience here and was well regarded throughout the state, as well as the state then used for a while, and then was fortunate or unfortunate enough to get to go to Kentucky for a few years, as someone who could come in and could pretty quickly assess, and I appreciate your work and I appreciate your report. The one question, or one of the questions that I had, and it's trying to better understand, you're referring here to a 3-day rule.
Yes, sir.
And could you talk a little bit about that and help me to understand what you were looking at in that particular regard?
As noted in the report, Judge, Commissioners, it's nice to be before you again. Commissioner Johnson, Commissioner Brooks, Commissioner Fickle, I'm sorry I haven't.
We've never met before,
We've never
but
met
your
before.
reputation precedes you, so.
It gives me a little sense of PSTD or PTSD or whatever it is.
Yeah.
But as noted in the report, for years, the Juvenile Board had a policy that if a child is detained in the detention center, that the legal review by the district attorney's office should occur within 3 days and a petition filed. It muddies the water a little bit to say that that original rule talked about a child potentially would be released from detention if that petition was not filed within the 3 days. I don't know that that happened a great deal, and that's sort of the wrong emphasis to put. A juvenile judge and the juvenile court has the ultimate authority of whether a child is detained or not detained. They have the ultimate authority of when a child is released or not released. And it really is not affected by the 3-day rule. The 3-day rule was simply to encourage the legal review of that case and a filing of a petition so that then the court process could begin to move forward. Juveniles in the state of Texas do not have access to bail or bond. They're at the mercy of the juvenile court, and everything within the juvenile justice system says that detainment should be short-term temporary, and that the cases should be moved forward expeditiously. The 3-day rule was an attempt to make sure that occurred.
Okay, and then the other question that I wasn't quite as clear on, the 30-day rule you talk about as far as mandating that juvenile services had 30 days in which to, that if they were going to present something to the DA, they had to present it within 30 days, and I think that previous to that, it had been 180. Maybe I misunderstood the...
There is a plan called the Alternative Referral Plan. This is required by the Family Code. It's an agreement between the District Attorney's Office, Juvenile Services, and approved by the Juvenile Board. The plan stipulates or states that all felony, including violent referrals, are all forwarded to the DA's office for review, which is appropriate in the way it should be. The second part, or one of the parts of the Alternative Referral Plan, refers to those lesser cases, the misdemeanor cases. Historically, the juvenile department has had discretion in what to do with misdemeanor cases as far as supervisory caution, diversion, or informal adjustment, or informal probation, or deferred prosecution, which usually is 6 months. That's the 180 days you're referring to. If the juvenile department decided to put a child or a youth on deferred prosecution, they could be supervised for up to 6 months. At any time during that point of 6 months, if there is an issue with the case, then it could be referred to the DA's office and legal action taken if appropriate. With the new Alternative Referral Plan, any case, including misdemeanors, were required to be referred to the DA's office within 30 days. That limits the juvenile department and a probation officer from making appropriate programmatic and service decisions about what a child needs or what a youth needs. It encourages the referral to the DA's office, and it really makes those minor cases legal decisions rather than programmatic or service decisions. It results, I think, in more cases being referred to the DA's office. I'm not sure that it's appropriate in those cases that all of those be legal decisions. They should be programmatic decisions.
So it puts more work on the DA's office?
I believe it does, yes, sir.
Okay. I don't know if anybody...
Yeah. Go ahead.
Terry, thank you for your report.
Yes, sir.
It sheds a light on some things that have changed in our juvenile justice system, of which this court has not been aware. We were not aware of the increase in the average daily census. We were not aware of the increases in average length of stay. We were not aware of the tendency of the current court out there to stack up bodies of juveniles in the juvenile detention center rather than observing our previous policies of getting those kids on alternative offense referral plans so that they could be managed in a community-based setting rather than sitting for long periods of time in our juvenile detention center. And finally, we were certainly not aware of the disparity in the racial makeup, racial and ethnic makeup of the kids who are incarcerated long-term at the juvenile detention center. It is difficult to imagine that it is accidental that over 90% of the long-term incarcerations in our juvenile detention center are either African American or Hispanic, and that only 7% of those incarcerated long-term are Anglo. It boggles the mind to think that that could occur accidentally. I don't believe that it can. So there is something systemically wrong at our juvenile detention center. And I thank you for your report and for bringing the attention of this court to those items that have turned systemically in the wrong direction.
So Mr. Cockrell, so I did read the report and saw your list of recommendations. And to Commissioner Brooks's point, I just wanted to talk about these numbers. Attention, well, this was item 5 of the recommendations. Attention and exploration should be given as to why such a large percentage of juveniles in detention are youth of color. On June 27 of 2022, 92% of the detainees were kids of color. Black juvenile represented 67% and 25% were Hispanic. Only 9% were white. This is a gross overrepresentation of juveniles of color in Tarrant County. You go on in your recommendations to talk about a position that should be created to monitor these timeframes. So in my initial reading of the recommendations, that obviously stood out to me as having a budgetary impact, right, for the purposes of us creating a position. But what else in here, I want to make sure I'm not missing what else that means for things that we need to take action on in this current budget cycle.
I believe that's the only item that would have budgetary impact on the recommendations that I made.
And obviously, I mean, the fix of some of these issues would have budgetary impact, because earlier on in the report, it talks about what the cost is right now. $5.3 million. Yeah.
And Commissioner, some of the thoughts that I have would also be to continue to delay right now the 323rd budget, because, I'm wondering whether we should defund the 2 associate judges because of some of the comments in the report, some of the findings in the report. So, I have to tell you that having read the report, I was very disturbed, not with the staff, not with Benny and his staff, because I think they're working as hard as they can work, and they've got vacancies. They, like most of our other detention center down the road, is short-staffed. The state is again refusing to take the folks that they are responsible for taking, but these are kids. And I think we've got to remember that. And yes, some of them have committed some pretty serious, crimes, but they're still kids. And I can't help but recall that as I have called employees who have been with the county for many years, and especially many of those in the juvenile services area, they talk about the fact that kids will come up to them in stores or will come up to them in public and thank them for what they did to help them, let's try everything we can before we get to detention. And that was something that I know you always stressed when you were here.
Yes.
Because I heard it many times. And I think we've lost that as we've gone through the process. And it's just going through and looking, these ghost courts. The failure to, they might set hearings, but more than 2/3 of them are passed for whatever the reason may be, they're passed. And the fact that there were no hearings other than just the detention from mid-February to mid-March of this year, which just so happened to be early voting to election, is very disturbing to me. We got a job to do, and they ought to be doing the job. And we've all run for office, but that's never, I don't think, interfered with us doing our job. And so I'm not real pleased about continuing those associate courts. Tomorrow will be the juvenile board meeting. I guess what I'm saying is, for today, I want to immediately look at the court about contracting with the Casey Foundation about coming in. Again, what we asked Kerry to do was to go in and do a quick glance and to see if he could get an idea of what was causing the overcrowding, the higher population numbers, because referrals have gone down dramatically, and yet the length of stay and the number of kids in our juvenile detention center has gone up just as dramatically. So it just wasn't logical, and that's what was of concern to the juvenile board. So Kerry wasn't asked to do a complete, detailed, long-term evaluation of the process, but I think what he recommended was for us to consider that. And so I would like to see the court, if we can agendize that or do whatever we need to at our next meeting. I'd like to see us look at putting in that request. As I said earlier, I would like for us to, I want to talk about this at the juvenile board meeting tomorrow and get a feel for whether the judges might, what their feeling is about defunding those two courts, our two associate courts. But I also want to talk with them about potentially, if we did away with those two associate judges, maybe we ask them to assign another family judge or just another district court judge to help oversee that. The backlog of cases, as I understand, in the juvenile area are about 600. Over in the criminal area, their backlogs on a per court basis average around 1,400. So it may be much more difficult of a case, but it doesn't sound like that we should be requiring 3 courts. But that's, again, something that I would like to ask the judges to do. The other thing I would like for us to look at is working and encouraging the DA to attempt to come back closer to the 3-day rule versus the 15 and the 30. And I see you standing in a minute, so I assume that means you'd probably like to say something, so I'll ask you to come up in a minute. But I think we need to do that. There was mention you mentioned the individual looking at it, maybe an advisory committee that could oversee and could include not only someone to look from a legal standpoint, but I just think we need to do something along that lines. And then the other thing is the appointment of attorneys. I'm not sure we're using the juvenile wheel, and we've got an attorney appointment group. And what I would like to ask is that I'm going to ask the board to have the appointment group maybe assign someone to the juvenile area to make sure that we're following the juvenile wheel when we appoint attorneys to represent the kids. And I'm not sure we're not having to also appoint attorneys to represent the parents in some instances. I don't know how that all works. Maybe that's totally separate. But I just would like to make sure we're following the appointment process. I was on that indigent defense council for many years, and sometimes we need to encourage the judges to follow the appointment process as drawn out by law. That's kind of what I hope to do, and maybe, I don't even know if we can take action on the Casey thing today, but that would be the only thing that I would want the court to consider. And it is a recommendation in a report that is on our agenda, so I'll ask you in a minute whether or not you think we could do that.
I'm ready to do that
if we can.
If we can.
And I just wanted to note that in the recommendation, it does lay out that that's at no cost to the county, so.
Right, the Casey Foundation report, so that wouldn't be anything that would be.
You can surely direct us to develop that agreement with them and bring it back to the court for your formal approval.
That'd be great. If you could do that, contact them and let's see if we can. And I'd really like to get them in here as soon as possible because I think it's pretty critical.
That system out there is clearly broken. Historically, we've had a low census in our juvenile detention center because we believed in taking care of our juveniles in community-based settings. That has all gone by the wayside. And the fact that it has is wrong-headed. It is hard to understand how it is not racist. I don't throw that word around liberally or lightly. But if it walks like a duck and it quacks like a duck, it probably is a duck. We need to do something quickly to turn this thing around. It's about our children, and they are not fodder for the wheels of the criminal justice system. We need to be about trying to change their behaviors while they are kids, not incarcerate them so that they learn how to be better criminals.
And I agree. I mean, this is about kids, and this is what we've got to do. You know, the bean counter is the bean counter. 5.3 million. You know, we hear that this court was to be the most efficient court. Well, efficient doesn't mean we spend an extra 5.3 million from that perspective. The kids are the number one thing that we've got to be looking out for, and I don't think we've been looking out for them. So.
Well, and I would add that if we're talking about $5.3 million that is actually going towards restorative justice, that would be one thing, but that is not what this is at all. And then with the DA, were you still going to give remarks? And could you come to the mic so I could hear you a little better?
Thank you, Carrie.
Thank you, Carrie.
I just want to make a couple of things really clear, and that is only the juvenile judge decides who's detained. It's interesting to me how in this report that you all requested about the detention of juveniles, somehow filing decisions by the DA's office became part of the recommendations and at the top of the list. So I want to address those two concerns if you'll allow me to. The first is the 3-day rule, which is not a rule. It's been a practice in Tarrant County, and remember that it was a practice for the juvenile judge. It was support for the juvenile judge to release a defendant, a juvenile who was held in detention, if the state didn't file the case in 3 days. The judge still can. The judge always can. There is no data in this report at all about our office being slow in filing cases. None at all. In fact, we're listed as problems in this report, and we were never even talked to. No one in my office was talked to by Mr. Cockrell. So I don't know what our filing is. We're happy to work with Mr. Cockrell and look at the filing, but the law specifically says that a state's filing decision cannot be the grounds for the detention of a juvenile. The judge detains the juvenile based on their own decisions, and we have no data that our filing times have increased or what they are. Keep in mind the 3-day rule was for the juvenile judge to release a person. He still can. Everything is pointed toward a judge being allowed to release people. This is not, that 3-day rule, while it might have been a really big thing 20 years ago, 18 years ago, I don't know that we're violating it at all. And I don't know, I literally don't know what the judge is doing about whether he releases people in 3 days.
This was not in any way intended to be an indictment of the district attorney's office. It was intended to be an encouragement to that judge to get back to practices that support community-based corrections for our children. Nothing wrong with the district attorney's office. You're not accused of doing anything wrong. In this report, to take that position is to misread this report.
Well,
and I read the entire report multiple times. I just was surprised to see those two things in my office listed as 1 and 2. Yes, ma'am, I'm sorry.
Well, I was just gonna add to Commissioner Brooks's point. When I read the report, although there were frequent mentions of the DA's office, I did not read it as the issues were with the DA's office.
No,
I just saw that as
all.
providing the context.
If you,
Well, let me get out, because I do feel, I don't know, I mean, I want to do some checking. You can go back and check also. But it was my understanding that at least several years ago, before 2019, that that if a case was brought in, a detainee referral, that the DA would look at it and make a decision usually within 3, 4, 5 days.
I think that we still do.
Okay.
I mean, there's no data to say that we don't.
Maybe, but the impression that I've gotten with talking with some of the folks out there is no, it may be closer to 13 or 14 days on misdemeanors and closer to 25 on felonies. And the judge is going to wait. And I think that the reason they were encouraging that is so that they could move those people out as quickly as possible. Now, maybe some of that was because of the fact that the 30-day has now put a lot more workload on your people. I don't know. But you can go back, you know, my guess is you got somebody right now looking to see what the numbers of days are. And I mean, I think that's something we can pull probably from where'd Chandler go? From our juvenile justice tech share program. And it'll tell us, here's the day they came in, here's the day you issued your deal. And so we'll be able to look at that, but I think what Carrie was saying is, and I think what other judges have said is that the judge is not going to release until they see that.
It's different at juvenile court. I was a prosecutor at juvenile court back in the age of Carrie, or right before him, sorry. And I can tell you that the judge had no problem letting somebody out if the state hadn't filed their case. That's what the rules are. That is what the rules are. And let me just add to this, because I want to address the alternative referral plan, which is required by law and which was rewritten in 2019. And things may have changed in 2019 about the use of the 3-day rule, but that coincides with the new judiciary out there, not necessarily our office or what we've done. Second thing, the alternative referral plan. It was interesting because Carrie stood here and said that these are lesser cases. They're the misdemeanor cases. These are not the cases where somebody would be in the detention center. So the alternative referral plan is not about who's in the detention center. What it is about is the changes in criminal law in the intervening years since the previous plan in 1999. And the big change is the discovery required in criminal cases by the Michael Morton Act. So what happened in the alternative referral plan from 99 to now, or to 2019, was that the decision period went from 6 months to 30 days. And yes, in that 6-month period of time, the juvenile probation department may decide we're going to work with this juvenile and put him in a program. That's great. We want them to put them in programs. I don't need additional criminal cases filed. I need them to make good decisions and take people out of the criminal justice system. I will tell you that what they have done is try to hold that criminal case over the child's head and say, I'm going to refile it if you don't behave. Well, that's what we call probation, right? But these people are not on probation. The problem is, if we wait 6 months while they hold it over the child's head, the child does not change their behavior and they try to file it, then I'm trying to get a case file from a law enforcement agency that will satisfy Michael Morton and discovery. And that is not going to work. Because Michael Morton, as you well know, requires that we get all the video, all the discovery, and we have to have it so we can give it to the defense. So by waiting 6 months, we can't do that. And that's why the alternative referral plan that was proposed from our office was worked out and approved by the entire juvenile board in 2019. It wasn't some malevolent, bad thing. It wasn't malicious. We're not trying to keep people out of treatment or programs. I want them to be in programs. I just need them to live with the decision. Just go ahead and put them in programs and live with that decision. Don't try to refile a case later because we can't do it. Does that make sense?
Well, not really.
Okay.
And the reason I say that is because if you're saying that they've got to refer it to you within 30 days, then they really don't have an opportunity to try to work with, whether it be Lena Pope, whether it be one of the other groups, I don't think. And I'm somewhat encouraged by the fact that our current director's shaking his head yes back there. Sorry about that if I just outed you. But they certainly feel like that if they've got to do it in 30 days, that doesn't leave them much hope of being able to work with them for 6 months.
And Judge, here's the distinction I'm drawing. Making the decision to work with that child versus filing a criminal case. Work with the child instead of filing a criminal case and live with that decision. Just live with the decision. Don't say, I'm going to work with this child, I'm going to hold the DA's office criminal case over your head for 6 months, and then we're going to file it later, because then you'll be giving me cases that I literally, if they act bad enough in 6 months to get that case filed, then I can't file that case because I can't get my discovery together. I can't get the reports, I can't get the video. The laws have changed. The laws have changed in the last 18 years, and they favor the defendants. That's the whole point of Michael Morton. And so it favors the juvenile. It favors the juvenile, and that's as it should be. They would make a decision under the current plan, make a decision and then work with them. So yes, in 30 days, they ought to be able to make a decision whether or not this youth should be in a program. They probably know that in the first week.
Well, we'll just have to disagree.
Okay, so I have a question.
We can ask Benny to come up if he wants to, and I know I'm putting you on.
I don't want to put Benny at odds with that judge out there, because it's not Benny's system that's at fault. It's the judge. And the goal should be to get these kids out of detention.
Absolutely.
And anything else is the games that grown people play. And that's a bunch of bull.
That's kind of how I feel about our mention in here, is that these were legal decisions that were made in discussions with the juvenile board about an order that was passed in 1999 that has nothing to do with the people in detention. Has nothing to do. That's what Carrie said. Carrie said the people in the alternative referral plan are the low-level people that aren't going to be in detention anyway.
The alternative deferral plan was changed in 2019, not 1999.
I'm sorry, the original one was in 1999. It was changed in 2019, and it changed after Michael Morton. And it simply has nothing to do with the number of people in detention. The detention population is a sole function of the juvenile judge, period.
I think we've
Okay.
agreed with that.
So we're supposed to be getting numbers on these referrals? Is that what I'm hearing? Or if I didn't hear that correctly, that's what I'm requesting.
I would love it. I would love to be able to get, so we actually don't have access to the juvenile data for the most part because juvenile is a separate system. I would love to have had the opportunity to talk to Carrie because laws have changed dramatically. And maybe it might have helped if he'd heard the reason for some of the changes, but be that as it may. Maybe
Well,
we
hopefully
can
you'll
talk to
get to
him
talk
now.
with the Casey Foundation.
Okay, so GK, how are we moving forward on this?
So, we're gonna go ahead and we can access our juvenile software. And we just had a very brief discussion this morning, and we're going to work through that. What we're gonna try to do is by the time we come back in 2 weeks, we're going to have that information for you.
Okay.
Okay. However, for full disclosure, we're gonna have the numbers, we're going to talk with some of the judiciary, we're gonna talk with the district attorney's office. So hopefully when we come in here, obviously, Mr. Cochran will be part of those discussions. So that when we come in here, we will all agree what the numbers are and what they aren't. If not, well, then we can understand why there's a difference of opinion. Okay?
Okay.
So that's what we're gonna be doing on the 29th. Hopefully, we'll also have a contract for you with the Casey Foundation on the 29th. That's 2 weeks. I think we've got time to do that.
Thank you,
And
sir.
we'll move forward in that vein.
Okay, I'm good with that. Here's what I also would like is, in the report, there were mention of some of the juveniles who had, one had been in detention 515 days, 336 days, 263 days. I mean, these are important numbers, and each day represents a day in the life of a juvenile who maybe is somewhere that they should no longer be, and then also just this increased workload and stress and everything and what it means for our staff in juvenile. And now, of course, I'm not asking for any private information, but I would like to see a case study on one of these to understand there's a person behind this number, and I'd like to get a better sense of who we're talking about.
There is a child behind those numbers.
Yeah.
I understand
A
what you're
child.
asking. Yes, sir.
Okay.
I'm sorry.
Yeah.
But I will tell you that we need to work very closely with juvenile and also the DAA on that because we are talking about minors.
Exactly.
And so let us see what we can do, but we'll be aggressive on that area.
Great. Thank you.
Are we ready to move on?
Yes.
You got something else?
Yes, sir. I'm gonna let Helen take it from here.
Well, actually,
Thank you, Mr. Cockrell.
She has some really good news. So.
okay, so I said that was my last thing on this, but this is my last thing on this for right now, is in the recommendations, there is the position, which that seems an obvious budgetary impact decision we need to make in this cycle, but others, so when we come back in 2 weeks, what are the others? Any other budgetary,
With the 323rd?
yes.
And I'm not sure about this position either, if it's supposed to be in the 323rd or it's actually in juvenile. So these are discussions I need to continue to have to see where the best placement of this position is.
Very good.
But I've written down the items that we've talked about, but the entire budget for the 323rd was not approved
Right.
in the budget hearing. So that's still something that we need to have happen. But there were 4 items that were to be considered outside of including the 323rd.
So before we do that, so your question was as relates to this discussion point that we're just having. In my opinion, one of the things that the Commissioners Court is going to need to consider is the funding or the defunding of magistrates out in the.
Not a magistrate, associate judges.
Are they?
Associate judges.
Okay, associate judges in the 323rd, because those positions are embedded in that
Court
in that
budget.
department.
Correct.
So I believe that's one of the questions that you're asking. So it'll be at least that. And one of the things, and the court doesn't need to take any other action on it, but one of the things that the court did, and staff was fully supportive of it, was you funded some additional detention probation officers in order to hit the staffing requirement for, I think, 120.
Juvenile probation officer.
Yes, yes. And so that is the only other budget item. You know, I think that, I personally, the county administrator's recommendation is that that was a good decision for the court to make and that we shouldn't really have to change that right now. Our relationship with juvenile probation is excellent, and it's always been with this court. So if there are issues where we're overstaffed, I know that we can work through those.
Okay. Thank you. That really was the last thing for now.
Okay. So back over to and in addition, to complete that statement, there were 15 positions that have been recommended and y'all voted on detention services and juvenile services and detention that y'all all approved on for that department, 21 in total. So there were 4 items that were left on the to be considered list. 323rd was one of them. The next one, another one was magistrate salaries. We did not vote on the magistrate cost center.
With regards to that, I believe there is a judges meeting post juvenile board meeting tomorrow, and I would like to talk with the judges about that and about the court reporters and about the maybe the court coordinators as well as maybe the bailiffs, and just see what, I mean, right now, they said they were okay as it was, which was 90%, but I just would like to talk with them about that in general and bring that back to the court.
That's good.
That sounds reasonable to me.
We need a structure that we can stick to on those salaries.
One of the other items that we left outstanding to be considered was the CPS cost center. We were waiting for the contract. We have received that, and we'll bring that back to the next court for y'all's approval. We've received the contract at this point in time. And then we have direction on the elected official salaries, and we have another outstanding item with the sheriff's office, which was the Bearcat. I have no additional information. Y'all were going to, I think Commissioner Fickus was going to find some more information regarding a presentation that he had seen.
Of course, there's not a need to take action on that today. We have a couple more court meetings. So if we're not prepared to do that, well, then we can still hold that particular.
Correct. But I do need some clarification prior to the September 13th date to present the budget to you. as far as public health or the reduction in the tax rate so that we can present a balanced budget?
Yes, ma'am.
My leaning right now is to leave public health where it is, at least for this year, and for us to lower the tax rate by half a penny on the county side this year. And my
And when the
reason,
shuffle
part of
is
my
made,
reason.
the half cent will have to be added again.
No, I don't think so, because I think this year, we had a good year. I think the next year we may not have as good a year as we had this year, but I think we will still have an increase in our revenue, and that will help us to absorb public health when it comes back. I think that from JPS's standpoint, quite honestly, I think if we did that, we're going to create pressure on JPS to potentially lower their tax rate, and with some of the operation, some of the infrastructure that they're going to be putting on over the next couple of years, they're going to need operational dollars. And so I think that's when the future court will have to look at that and determine whether or not they need to bring public health back to this side. We're very financially sound in the county. I think we have got our reserves up to where our bonding, past where our bonding folks have wanted us to be. We're well funded in our pension, and we've continued to make progress on that every year, additional progress on that every year. So I think there will be a couple of alternatives that we can look at in the next 1 to 2 years after this year, or y'all can look at, that will basically allow us to absorb that 13 and allow us this year to take the tax rate down a half a cent.
Judge, I hear what you're saying, and in a lot of ways it makes sense. However, pragmatically, if we're ever going to take public health back into the county budget, now is the time to do it. We cannot count on a future court ever making that decision. If we're going to do it, it's up to us to do it.
Again, JPS has already looked at that. They've got it built into their budget. They're happy with their budget. I hear what you're saying, but my preference would be for us to lower the tax rate here by half a cent and let them look into that in the future. And we can talk, I know.
I agree with the judge.
Well, we already took action earlier today to keep the rate the same.
Excuse me, I'm sorry.
No, we didn't.
That, I wasn't finished.
Okay.
So the action that we took earlier today, where we, on our tax rate and the hospital district's tax rate.
Yes, ma'am.
Okay. So what did we do?
So what we did, we set the maximum rate.
Right.
So that you can come back before or after September 13th.
Right.
And
So
set
we,
whatever rate you want, as long as it's below that, equal
Right.
to or below that rate.
so we couldn't increase it, but we could lower it.
That's correct.
Right, okay. I'm just making sure, that's what I thought that we did. But so we're having this conversation, and and I want to make sure that I understand from you, Helen, what you're asking from us right now is what?
Well, either today or on August the 29th.
30th, I believe.
30th, okay. That we have direction on whether it's public health coming in or reducing the rate so that we can present a balanced budget to you on September the 13th, excuse me.
So what we're saying, we'd like to have a decision package made by the 29th, which is in 2 weeks. On
30th.
that particular issue. 30th, I'm sorry. That's what you're saying?
Yes, sir.
Okay. So you're just looking for direction, not for a formal,
Not today, not today.
very good. Okay.
And those are the items that we left outstanding. So still is the magistrates and 323rd and the Bearcat. That's it.
So, that's it?
That's it.
Okay,
That's
very
all.
good. Your Honor, that's all we have on briefing.
We have another public comment.
Yes, we do.
Mr. Troy Cossin.
Judge, a few weeks ago, I was standing on the corner of Richmond and Hemphill in Fort Worth. I believe it is in Commissioner Brooks' precinct. A little 4-year-old girl named Isabel walked by, and she said, "Hello, Manuel Mata." You see, Isabel doesn't know who you are. She doesn't know who I am. She doesn't know who anyone in this room is, and probably never will. But she knows who Manuel Mata is. Manuel Mata is the political prisoner that you're holding in the Tarrant County Jail. If you check the charges that are pending against him, every single charge he has is connected to his First Amendment right to use one of these and record public officials in the course of their duties. That is the facts. Now, no matter how many times we explain this to the court, and we explain it to law enforcement like the gentleman in the back, they continue to put their hands on people, as they did at Tarrant Appraisal District. Now, I'm going to quote Chandler Crouch. You know who he is. Chandler Crouch is the man that Tarrant Appraisal District attacked. Chandler Crouch is the man who won his case against the complaints in Austin. Chandler Crouch says, when you're effective, they come after you. You see, the case of Chandler Crouch and the story about Tarrant Appraisal District would have never become public if Manuel Mata wasn't standing off to the side recording that day before any other mainstream media showed up. That's the truth. The front page article in the Star-Telegram, including the photo, was lifted from Manuel Mata's video. If you don't think he's a journalist, pay attention. The reality is that before the Tarrant Appraisal District meeting even started, Manuel Mata and I were invited into the boardroom, instructed to stand in a certain area when the meeting began, and within minutes, 6 Tarrant County Sheriff's deputies came and dragged us out the back door, assaulting us on the way out. No probable cause, no statement of a crime that was committed, no indication that they even had a bit of an investigation. The reality is he's now facing $13,500 in bail for charges like trespassing when he's standing on the public sidewalk, interference, which is a defense in Texas when it's free speech, and exercising his First Amendment right to record public officials in public. That's just the reality. I know you have a smirk on your face, but 6 deputies are under investigation by the Internal Affairs, by the District Attorney's Office, and Deputy J.D. Thomas, who works at TAD all the time, is also being investigated by Haltom City Police Department for some nonsense thing he did over there.
This time we'll recess our public meeting to closed meeting under section 551.071, 072, 074, 076, and 087 of the Texas Government Code. Thank you. 2. 3. Did anybody tell the? Anybody tell the court clerks that we're?
Do we get that now, Judge?
Yep. Regina's already blinked at me, so. And it's warm compared to what it is on I mean, you can hang meat in here. Having returned from our closed session, there being no business to conduct at this time, we stand adjourned.